healthcare in the United States has long been built around a single assumption. Access to care requires insurance. Over time, that assumption reshaped how care is delivered, how decisions are made, and who ultimately holds control. For many patients, the experience has become familiar. Limited options, delayed approvals, rising costs that continue without clear explanation. For physicians, a different strain has taken hold. Administrative demands expand. Time with patients contracts. Decisions are no longer guided solely by clinical judgment, but by systems operating in the background. Insurance was introduced as protection. In practice, it now often functions as a filter. This town hall examines how that shift took place, where control moved, who now influences care, and how both patients and physicians are navigating a system that increasingly stands between them. Two physicians step in to examine how care unfolds in practice and what influences it along the way. Dr. Peterson Pierre, founder of the Pierre Skin Care Institute, is known for delivering natural, patient-centered care across both cosmetic and medical dermatology. Dr. Simone Gold, physician, attorney, and founder of GoldCare, bringing a perspective shaped by years of confronting institutional constraints. Together, they outline how insurance structures shape access, cost, and quality, often in ways that remain unseen. They also examine what changes when those structures are removed. Direct relationships, transparent pricing, care no longer routed through layers of approval. The system has defined care for decades. What happens when that definition is challenged is now coming into view. GoldCare, built for you, powered by freedom, trusted by thousands.
Good evening and welcome to GoldCare Medical Town Hall. Tonight, we are talking about the hidden realities of the health insurance system. We'll explore how third-party control shapes medical decisions, limits access to care, and drives up costs for both patients and physicians. You'll gain clarity on why so many are frustrated with the current model and what a better path forward looks like. From restoring transparency to strengthening the doctor-patient relationship, this town hall outlines a more direct, patient-centered approach to care. Joining us is Dr. Peterson Pierre. He's a board-certified dermatologist with over 2 decades of experience in clinical practice and patient care. His work focuses on restoring physician autonomy and improving patient outcomes through a more personalized, direct approach to medicine. Our moderator is Dr. Simone Gold, founder and CEO of GoldCare Health and Wellness. At GoldCare, we're more than just a telehealth service. Not only can you see our providers for your medical needs, but you can also learn and understand how to navigate the medical industrial complex with our extensive library of educational materials. Coming to you very soon is GoldCare Insurance, our answer to the broken system that keeps you paying more and giving less and less value. You can learn more at goldcare.com/insurance. All right, Dr. Gold, let's get this conversation started.
Hello, everybody. It's great to be here. This is a subject that we could talk about for days and days, and it's actually pretty near and dear to my heart because it really is at the heart of so much of what is wrong with our modern medical system in America. I'm so happy to be joined tonight by my friend and colleague, Dr. Pierre, and I think it's going to be a great conversation because most of you know me as a person who pays a lot of attention to the policy implications and kind of the macro environment in which we spend our time in the medical world. And Dr. Pierre has his foot in 2 worlds. Some of that is the policy world, but he continues also to see patients clinically. And so he handles and discusses and thinks about these insurance issues, really on a daily basis, which is something that I've kind of left behind. So I think it's a really excellent balance. So I just want to start with, when COVID came along, a lot of people thought and think still that, big pharma is really essentially the big enemy. And there's no doubt that big pharma has done a lot of, they've had a very powerful impact in medical care. And a lot of it is negative. But to my mind, and what I've said for years, is that I think you could absolutely direct big pharma to be quite benevolent. I think big pharma is really following its financial interest. They're in business to make money, and Congress passed certain rules and laws that made it really easy for Big Pharma to go pursue things that are not in really the patient's interest. But I think that that could be corrected if Congress decided to change its policy direction. I'm not that optimistic about the insurance model. I don't think the insurance model, for the most part, can be fixed. I think there's just too much wrong with it. And so that's what we're really going to talk about tonight. So Dr. Pierre, a lot of people on this call, on this video today know me, but a lot of people don't yet know you, although many might because of all the videos that you've been doing. But if you could just share with the audience a bit about who you are, your background, why this is an interesting subject for you, et cetera.
Yeah, so I'm originally from New York City, moved to California 34 years ago to pursue my medical degree, then did my dermatology residency at Stanford, moved down to Southern California because we wanted to be closer to family in raising our kids. So the goal for me has always been to do what's in my patient's best interest. Now, that may sound like it's rather obvious, but sadly, over the years, I've come to realize that that's not really the goal of medicine. It should be, but a lot of doctors have other motives for a variety of reasons. There's the insurance company, insurance situation that we'll discuss. There's Big Pharma as well. There's also a certain amount of indoctrination that happens when you start the first day of medical school that most people are completely unaware of. Because if you didn't know this, the main financial contributor to medical education is actually Big Pharma. So if you think about it, it's not out of the kindness of their heart. They're really shaping the next generation of legal drug pushers. And yes, that's what I call a lot of doctors. Patients come in, they have a lot of time constraints, they can't really talk to patients. And sadly, I have a lot of patients who tell me they've seen multiple other doctors who just simply not listened to them. Within 5 minutes, they've got a diagnosis, here's your prescription, and they're off to the next patient. And what I've come to realize doing this for 20 plus years, you can learn a lot simply by listening to what the patient has to say. Yes, you still use your diagnostic acumen, you still look at patients, examine them, but you can learn a lot if you just listen to what they have to say, because that really is part of the entire package in helping you arrive at the best plan for that particular patient. So I tend to have very strong opinions about companies or individuals taking advantage of patients. I really dislike that, and it's an understatement. And part of that during COVID, I was really frustrated, isolated, because most of my colleagues simply ran with the narrative and promoted the propaganda. And being a doctor, I know literally hundreds of doctors, and there was only one that I could talk to because he saw just as clearly what was happening. And fortunately, later on it was either 2020 or 21, I was fortunate enough to meet Dr. Gold, and we came up with a plan on what we could do. And my goal is simply to arm people with the truth. So I always focus on the truth. I focus on facts. I'm not about opinions, or at least if I'm going to give you my opinion, I give you the facts first to support my opinion. But ultimately, you as the consumer, as the patient, as the family member, you have to make the decision that you feel is best for you. And that's really my job.
Right. And it's crazy because that's always what, we always thought doctors were, but you and I can attest that we were very, very much in the minority. So one of the huge pressures, as you said correctly, and absolutely starts in med school, is Big Pharma. We're taught, even if it's not Big Pharma in particular, like a particular company, just the way we're really taught to turn to drugs first. I mean, that is always what it is. You go through the first 2 years, you do all the basic classes, anatomy and biochemistry and, physiology and all of that stuff. And you actually learn what you need to learn. But when you get out then into the clinical years, the second half of medical school, It's very dependent on drugs and medication. Part of that is because the training is mostly in the hospitals, but there's zero, I don't know about you, but for in my training, there was zero emphasis on natural or non-pharmaceutical. It was always, which drug, change the drug. I mean, when I look back on it now, it's so obvious, but at the time I didn't really pick up on it so much. So definitely there's a huge pressure on the pharma side. But what we're going to talk about tonight really is the insurance model. And they are actually related because the insurance companies these days really dictate the care that you get. They really do set the terms. And I'm saying that because the policies that, whether you have Kaiser or Blue Cross or HealthNet or United Group, Health Group, those policies in broad strokes, it's kind of set by Medicare, and then the private insurance companies really follow those. Right. And that means they'll put out guidelines, they'll put out protocols. And if you deviate from those things, the insurance company will punish your doctor through payments and lack of payment. So it is possible sometimes for the doctor to work around that with lots of extra paperwork, but it's quite difficult. And after a while, doctors really can't afford to do that on every patient. You kind of give up. And I speak from personal experience. Even in the ER, this happened all the time. And I pushed back as much as I could, but I couldn't push back on everything. And I had a line in the sand, which my line was, I wouldn't order a drug for a patient until certain criteria was met, even though the protocol said I should order a drug for a patient. Right. A patient would come in and they'd meet criteria for sepsis. I was expected to order antibiotics within 1 hour. That was not realistic in most emergency department settings. So the nurses were really doing it from triage before I ever saw the patient. And I actually put my foot down. That was where I put my foot down. But to the extent that, first of all, I was rare. Most doctors didn't bother to do that. And the pressure was just every shift, every day that you should comply with the protocols. And I want people to understand that that's the pressure that your doctors are dealing with if you go to most insurance doctors. And I call them insurance doctors or sometimes government doctors. And those pressures are invisible to you. So you're having a pleasant conversation with your doctor and you think that they're giving you their kind of unfiltered opinion, but probably not. It's being filtered through the way they need to practice to get along with their payer. Because after all, you're not paying the doctor. The insurance company is paying the doctor. And I just want to at least make it real for people, because a lot of people think they can trust their doctor, they like their doctor, a lot less since COVID. But to the extent that you think that, you have no idea that the pressures that the doctors are facing long before they ever met you. You are, sometimes I like to say that, I'll give an example that everybody can use. So if you have children, right, and your child is, a toddler and she's, getting ready and she's kind of throwing a tantrum and she wants to wear the red dress or the blue dress, whatever it is, and she won't get dressed and she's having a tantrum. A wise parent will say, well, would you like to wear the red dress or would you like to wear the blue dress? And the child ponders it and they think, oh, I'd like to wear the red dress. And off they go happy, right? But that was the wise parent who didn't let the child think about the fact, well, there were pants and there were shorts and there were t-shirts and there were all kinds of other choices. Those choices were invisible to the toddler. And frankly, for those of you on this call, that is really how you are functioning in the medical world when you see a government or an insurance doctor. You really don't know the lay of the land. You don't know all the options, all the choices. They've been pre-curated for you based on essentially insurance protocols. I think that's I know I don't want to go so far as to say dangerous. I know it's much more expensive than it needs to be. It's much less user-friendly, and it absolutely takes away patient choice. That's for sure. And for that reason, and I might surprise you, Dr. Pierre, I don't think you've ever heard me say this, I have not had health insurance for 20 years. And I like dropping bombshell because people don't believe they can function in American society without health insurance. But I did. I had a workaround because it is important to protect your financial safety, right? You can't, lose your house and all of those things if something expensive comes along, but there were alternatives. And I sought those alternatives out. The reason this is important is that many people believe that they can't even think about medical issues except, what's my health insurance? What's my health insurance? What's my health insurance? And we're here to tell you a couple of things. One is it's not really built for you. It's not oriented around your best interest. It's definitely not oriented around your freedom of choice. If you have any kind of insurance, it almost always makes you go through the doctors that they select. And here's the kicker. It's not saving you money. It's costing you a fortune. If you calculate the money you're spending, it was a terrible financial decision. So I just wanted to kind of lay that out there. And what are your thoughts in general about insurance, Dr. Pierre, both as a person who has insurance and as a doctor who takes insurance and not?
Well, this is the way I always describe the insurance industry, and patients get it after I describe it this way. So think about it. You have a subscription that you're selling people, and they pay monthly. But the day you have the audacity to use it, they restrict how you can use it, when you can use it, and what you can use it for. Then they'll increase your rates every year. So your premium goes up, your deductible goes up, and what they cover goes down. Now, from a business standpoint, that's a pretty brilliant business model. But as far as healthcare for you, I like to separate insurance and healthcare because even though they're connected, they're not the same. So healthcare is basically you come to your doctor to try to get the best possible advice for you. The insurance is the payer. That's where the problem is, because a good doctor wants to make decisions that are best for his or her patients. The patient obviously wants decisions that are best for them and their family, but you have a disinterested third party who doesn't care about the patients or the doctors and simply interested in boosting their revenue.
Right.
So that's part of the problem right there. You have a company that's in charge of paying, but really doesn't care about anyone. And you know for sure that next year you'll be paying more and you'll be getting less.
I want to share with people why health insurance actually increases your costs. Anybody who's paying for health insurance out of pocket knows that they're spending a fortune. The typical price is probably about $2,400 a month now for a family of 4. Some of you know that. Some of you don't know that completely because your employer is paying part of it or rarely all of it. But it's about $2,400 for a family of 4. What you're getting for that is really quite pitiful. You're getting, you're told that, you have a deductible, and I would say maybe $8,000 is a common deductible. And you think, okay, I'm spending $2,400 a month and my maximum financial liability, should something happen, is $8,000, but that's not true. There's copays, there's coinsurance, and there's out of pocket, and then there's out of network, which I'll get to. Your actual out-of-pocket expenses on a typical like $8,000 deductible is actually double. It's about double that. So what are you really getting for the $2,400? You're not getting great financial protection. I would suggest that $16,000 is not great financial protection for something you're spending $2,400 a month on. Are you getting freedom of choice? No. If you have health insurance, you are constricting your choice options, and not by a little, massively. There are many doctors you can't go to. Many doctors are out of network. You have to get approval. You have to get pre-authorization. It completely constricts. And here's something that a few of you might know, but most of you don't know. If you have health insurance, the prices are actually higher. How do you know this? If you go to a hospital, let's say, and you don't have your insurance card, you go in a self-pay, maybe you forgot your card at home, you don't have it, and they register you as self-pay, you will discover that your self-pay price is usually between a third to half of what the insurance price is. I mean, that is actually stunning. For the privilege of paying Blue Cross, for example, or Kaiser, $2,400 a month, you're actually paying more. It's outrageous. People don't realize that the cash prices are lower. What you need is you need a financial safety net. Everything else should be purchased out of pocket. When you purchase your medical consumption, Through the insurance model, you are overpaying for many reasons. One is there's a lot of administrative overhead to manage the system. Another is you're paying for that kind of readiness. Insurance is there for an emergency, very much like my career in the emergency department. We had to have the ER completely staffed, completely ready, no matter what, whether a patient came in or didn't come in. So the patient that came in, they got charged a lot, even if it was a minor problem, because you had to kind of support the infrastructure. That's what insurance is. So when you route your normal, ordinary health expenses, like an annual physical or a blood test that you're going to have, your common meds that you take all the time, you're going to be paying double to triple, probably more than what the costs actually are. And that's just like a really quick overview, but getting your ordinary consumer purchases through insurance increases the price tremendously. I think.
Absolutely.
Yeah.
So I'll give you a simple example. So if you get a routine blood panel, whatever, if you ever look at the explanation of benefits, they'll charge the insurance something like $1,600, which to me is absolutely absurd, when really the out-of-pocket cost is more like $200. And a lot of these tests, interestingly enough, are now available for purchase online, where you can spend even less money. The prices are so overinflated, it is really mind-boggling if you ever take the opportunity to look at those explanation of benefits.
So that's one of the reasons I went off health insurance many years ago. I'm a complete insider. I know the system inside and out. The reason I left the health insurance model was not for me, primarily financial. For me, it was, I didn't want anyone to tell me who I could see and who I couldn't see. But it was I would have eventually made the decision anyway, just based on pure finances. It is so financially inefficient to use health insurance to pay for your routine care. The example you gave, Dr. Pierre, is perfect. So here's a great one. You can go to an ER. Let's say your kid falls and hurts his shoulder, hurts his arm, and you go to the ER and you get you see the ER doctor, you get an X-ray, you are told there's maybe broken collarbone, or maybe broken humerus, whatever, and then you get put in a sling or splint, and then you're sent off to see the orthopedist a week later. He sees you, he does another X-ray, right? This is a real life example that we have as somebody who switched to us. So the person paid out of pocket $75 for the X-ray. They paid out of pocket, that was the copay. The out of pocket copay for the orthopedist, because he was a specialist, I think they paid $80. I think his normal fee would have been around $300. And for the ER visit, they ended up paying about $300, something like that. When you added up their out of pocket expense, their copay, they had Kaiser, this family, their copay was about $1,000. And I just started laughing. I said, if you didn't have insurance, we could have gotten that whole thing done. You could have gone to an urgent care, you could have gotten an X-ray. So the X-ray that he had was about $50 if you paid cash. The orthopedist would have been very happy to take $200 as a quick visit. It was a very simple problem. All these things. So you would have actually paid less on the copay that the insurance was covering you, not to mention the fact that you're spending $2,400 a month on insurance. So that's something that I really want to emphasize. So people who are in their 40s and older, or certainly in their 50s and older, grew up with an insurance model that I believe was better than it is now. I don't believe it was quite as corrupt as it is now. Back then, they weren't routing every ordinary medical expense through insurance. It really was more for the unexpected, financially risky situations. Now, because we're routing virtually all of our health expenses through insurance, the insurance companies have raised the prices enormously, and you're essentially paying for the premiums as pure profit going to the company, and you're essentially paying the other stuff out of pocket. If you go get a blood test, I was thinking on the smaller blood test, you can go get a CBC, and your copay on the CBC might be $18. You might think that's so great that my insurance paid the rest and I only had to pay $18. But you could get a CBC, which is a complete blood test for like $6 or $5. It's unbelievably cheap. Right. And that's the thing that people don't realize. So I'm very much against health insurance because it constricts your freedom and it's taking money out of your pocket. And everyone who knows me knows I'm all about freedom. And you don't have much freedom if you have no money in your pocket. So I'm in favor of people being able to keep the money, their hard-earned money. We got to this mess. There's many variables why we got here, but I realized I really should stop and ask Drew to just check in with us. I haven't seen.
Thank you, Dr. Gold. You know, what was so interesting about what you're saying is I, like you, decided not to have health insurance about 15 years ago. And the thing that really did it for me is that when my wife and I wanted to start our family, I was told that the maternity coverage that we had for our health insurance couldn't be used for 18 months. So I had an insurance company telling me I couldn't start a family for 18 months, which is just crazy and totally out of control. Thought that was a really interesting thing I just wanted to bring up and share with you. Let's go back to the conversation.
Actually, I hope Drew at the next like break, you're going to have to come back, Drew, and tell the audience what you did because of that, because you of course wanted to have children and had health insurance, et cetera. Because that's a little bit of a cliffhanger. Like, what did you do after that? But for me, it's funny. We independently came to the same decision. I went off health insurance, but so we built GoldCare, and Dr. Pierre, of course, works for GoldCare, and so we built a better way forward to answer your questions and to have you have access to honorable physicians. But many of you out there don't really understand that there's a difference between insurance and healthcare, right? Getting just access to good, caring doctors. Because of that, and because virtually all health insurance products that are out there, in my opinion, are not really thinking of the patient first. I don't want to use unethical so broadly on this video, but I have my doubts about the insurance model. We at GoldCare have spent considerable time and effort to bring you a better insurance product, and that's GoldCare Insurance. And we're going to bring it to market sometime in May, perhaps May 1st, perhaps May 5th or 10th, but sometime in May. And it carries my name. So I can assure you that it's ethical, it's honorable, and it's patient-centered. And it's built around the way I want people to access their medical care, which is the same way I did it, which is you need to have a relationship with your doctor. The relationship needs to be between the doctor and the patient, and the middleman needs to get out of the way. And that's what GoldCare Insurance does. We move the middleman out of the way, but we make sure that you have financial protection for an expensive situation. You can go to any doctor. I haven't even told you all the details, Dr. Pierre, but there's no such thing as in-network or out-of-network. It's nothing like that. But you have good financial coverage protection in case of something expensive. The deductible is $3,000, which is very low for a deductible these days. And after you hit the $3,000, you then have complete coverage, which is such an advantage over everything else that's out there, because other companies, Blue Cross, Kaiser, United Health Group, once you hit the deductible, you still have those co-pays. And that's why your deductible isn't the real ceiling. Like, they might say your deductible is $8,000, but after $8,000, then they share the cost with you. We're like, no, it's just so complicated. When you have a health emergency, you don't even want to deal with those complicated explanation of benefits. We don't do any of that. So that's what we're going to bring out. We're going to bring it to everybody. I want everyone to check it out. Drew will give us the link in a moment, but you need to sign up if you're interested, if you want to learn more about it, like an ethical, less expensive, much more honorable way to access good, caring doctors. And you know what? We're going to see if Dr. Pierre is going to switch. We'll have to see.
Yeah, I'm all for it. But I will go ahead and say, actually, insurance companies are unethical. And I'll give you a perfect example. And this is something most patients don't know. Every 3 to 5 years, insurance companies, Blue Cross, Blue Shield, United, Aetna, the big ones, are actually sued for illegal activity, denying patients treatment, denying prescriptions, and denying doctors payment. Guess what happens every time they're sued? They actually lose the lawsuits because what they're doing is illegal. However, they make a business decision. So if I save, I'll just pick a random figure, $10 million through this illegal activity, and I'm ordered to pay $2 million, well, that's not much of a deterrent to my activity. I will keep doing it. I will keep getting sued. It's just the cost of business, but I still keep 80%. So a lot of patients don't understand what happens behind the scenes, but what insurance companies are doing is in fact illegal. It breaks the contract that they themselves have drawn up and have had patients sign and doctors sign. They just don't stick to it. And there's no one to hold them accountable. Yes, the lawsuit is good. Yes, quote unquote, justice has been served. But if the penalty isn't severe enough, it doesn't serve as a deterrent.
Yeah, and you're also being generous, like I was being generous a moment ago. It's so, who wants to sit there and sue their own insurance company? You're so angry. You spent this premium this month after month in good faith, not using it. And then the moment you have to use it. And by the way, most of us, I think, kind of instinctively know this. I mean, you know that when you get into an accident, you have a car accident, you know that there's a fight with an insurance company. Like, you know
Oh,
that.
yeah.
But the health insurance bills are really high when you've had something. And also the decisions, you don't want to be pressured in that moment to make this decision or that decision when the person advising you has a financial stake in the choice you make. You want to be able to make that choice separate from financial interest. You want to be able to talk to this doctor or that doctor and come up with a decision. And that's not how it's going at all. That's really why I left the insurance model. I didn't want to have an insurance company telling me what I could do, what I couldn't do, what I needed their permission to do. I just think I just can't live like that. I think if people understood that that's what they were signing up for, they were signing up for a very expensive system that completely eliminates most choice. Who would sign up for that? A friend of mine, she had insurance. They were very, very healthy. They're actually now GoldCare members. They live very healthy lifestyles. So blessedly, no one came down with anything terrible. So when you calculated the amount of money they'd spent $250,000 in 10 years on insurance premiums, right? Yeah. And then the one time they go to the ER with the kid with the arm, they end up paying about $1,000. And who wants to be in that situation? You end up very angry at your own insurance company. So be done with it. Our advice at GoldCare is that to leave that old broken insurance model. It's telling you who you can see, who you can't see. It's making decisions for you that you're not even aware of. So you're not even aware sometimes you're being turned down for things. You are steered to certain doctors, not other doctors. And by the way, there's no quality interest why they're choosing some doctors. It's a price decision. They pick doctors based on the price. And I'm not saying good or bad. I'm just saying it's not a relevant factor. And when it's your situation and your body and your health, don't you want to make the decisions? And don't you want to know the variables that go into making that decision? So we're here to tell you that there is a better way forward. I think sometimes people sort of feel hopeless, like what's the way forward? Now, Dr. Pierre, on this call, we probably have people, all different situations. Some people are self-insured, meaning self-pay rather, right. Like they don't have the insurance. And some people are getting their health insurance partially through their employer or all through their employer or a little bit through their employer. Some people are Medicare. So I want to invite especially the people that are currently self-pay, that are just kind of taking their chances, to check out GoldCare Insurance, because I don't want people to go bankrupt because something bad happened. I mean, we really do want to be protected against that. Absolutely. If you're a small business owner and you don't check out GoldCare Insurance, shame on you, because this really affects your bottom line. As you know, that the biggest sort of discretionary item in your budget for most businesses now is that line item for health insurance for the workers. And there's a better way forward. So definitely if you're a small business owner, you absolutely should. And if you're paying, you're employed by somebody else, but you're still paying your own health insurance, like maybe you're a hairdresser, self-employed, or your employer doesn't cover it, absolutely you need to check out GoldCare Insurance for sure. Shortly after we bring the GoldCare Insurance for individuals, we will also have GoldCare Insurance for businesses. So if you're a business owner, absolutely check it out. We haven't yet seen any business where we won't save at least 25% off of what you're paying. And we think most of the time it'll be closer to 30%. That's very substantial if you're a small business owner. So I hope people come check it out.
It's all about having options, really. Yeah. So I think most people who are in the system know the system is broken beyond repair. We're providing an alternative.
Right.
It doesn't hurt to check it out.
Right. So I want people to, obviously, I think what changes people's decisions, because it's hard to, change from one system to another, when you have to change your, your phone carrier, your bank, it's like, it's a lot, to think about. So think about two things. One is you're going to save money, and you're also going to have freedom. So depending on which one's more important to you, I told you that for me, when I was young, when I switched, it was all about freedom. But I think for most people, it's actually about the financial, like that they can save money. I'm telling you, they're both unbelievably important. You can save money if you switch to GoldCare insurance, and you can maximize your freedom, meaning, God forbid, you need to actually use it and you want to pick who you want to see. GoldCare insurance gives you that total freedom. So those are, I just, like, let's say they want to come in and see Dr. Pierre. By the way, maybe you could speak to this, Dr. Pierre. Most of the doctors I know, it's somewhat geographically dependent, but most of the doctors I know in bigger cities, many of them won't take insurance anymore. They'll have such demand in their practice that they actually don't take insurance. I'm not saying it's true for everybody in every discipline, but I've known, for example, many orthopedists now that actually won't even take insurance because they're just done with it. There's so many phone calls, they have to get pre-authorization, they have to do all this, and they've discovered that the cash price for patients is something that patients can afford. So you can literally do a hip or a knee, and the person can put it on their credit card, and it's less expensive. And so there are many doctors that won't even take insurance anymore. That being the case, why are you paying the insurance? I mean, let's say the doctor you want won't even take your insurance, or he's out of network for you. All that money you've given to the insurance company, they're not even helping you.
Right.
Yeah.
Yeah.
So
that's 100% the case.
It's 100% the case. So
yeah.
So I want to teach people, you need a financial safety net. We are not in favor of you going without a financial safety net. You'll get away with it most of the time, but it really is Russian roulette. Something can happen. And if you own a house or you have dependents, you're married or kids, the number one cause of personal bankruptcy in our country are these health expenses. Right. So I do want you to have a financial safety net. But that's entirely different than traditional health insurance. You need to get this. So this is what GoldCare insurance will bring you, is that financial safety net and total medical freedom. And I'm going to go back to Drew.
Thanks, Dr. Gold. Yes, exactly. I guess I did leave you on a little bit of a cliffhanger. So what I ended up doing is I did get off of my traditional health insurance plan, $900 a month, but I had to wait 18 months till my wife and I could start our family, which is just a crazy thing to think about. And we decided to pay cash to have our baby at the hospital, and it was $2,000. So 2 months of health insurance covered the cost to cash pay to have a baby at the hospital, which I know in many instances has been more than $10,000 to $20,000 if it's billed through insurance, which is just wild. There are a few questions inside the chat right now, which I'd like for you to touch on, Dr. Gold, really around Medicare and how that works with insurance and or using something like GoldCare insurance.
Yes, I'm so glad you brought that up. We cannot replace Medicare at this time with GoldCare insurance. So the way Medicare patients should take care of themselves and take care of their health is to be a GoldCare member. That's $17 a month. I feel very strongly about this because Medicare patients are going to Medicare doctors, which are very controlled by those protocols I mentioned in the beginning. And you need to go into those appointments as an educated, smart consumer. You have no idea what you don't know. You don't know if you're supposed to be on Lipitor. You don't know if you're supposed to be taking an aspirin. You don't know if you're supposed to be on the psychiatric medication. You literally don't know. You don't know if you need a colonoscopy. You're told you need those things, but you actually don't know. Do you need a breast biopsy when there's a breast lump? Like, there's so many things that you haven't thought about in oncology and cardiology that I want you to have the best information, and then you go to your Medicare doctor as a smart consumer. You need to do that. We saw during COVID that Medicare patients were very abused. They were mistreated terribly. I don't want to waste our time right now talking about it, but the reason we set GoldCare up the way we did was so that everybody can afford it, everybody can get that good information. So for Medicare, I urge you to just kind of keep whatever situation you've got right now for your insurance, become a GoldCare member, and always do a consult with one of our doctors before you go to your Medicare doctor. So you can find out exactly either what questions to ask or to verify that what you were told was really the best advice.
Thank you, Dr. Gold. Let's continue our conversation with Dr. Pierre.
So what do you do in your practice? Do you take, in your private practice, do you take insurance? Do you take all insurances? Do you take some insurance? How does that work?
I take some insurance because it definitely helps patients, but the bills are always a question, you know? So you got a certain amount that's charged, patients don't understand. It's not transparent at all. We use a bunch of codes that really don't mean anything to anyone. And then you got the explanation of benefits, and this is the negotiated rate. Then this is your portion. This is your copay, coinsurance, things like that. And insurances in general are simply not interested in their customers.
Yeah. Do you have you seen a shift, a demographic shift at all from people moving away, or like what is your experience? Do you feel that people understand that insurance is not their friend, is not?
Yeah, so I have some patients who completely understand, and I have other patients who are completely clueless. So some patients feel, well, I have insurance, therefore everything is covered. And I have to explain to them, no, everything's not covered. When you have insurance, the insurance company still decides what they are going to pay for. And covered doesn't necessarily mean free. Covered simply means, yes, you can bill the insurance for this particular office visit or procedure. They still can deny it, or even if they approve it, it may go towards your deductible, in which case you're paying, in addition to what you're paying every month, you're still paying for the procedure or the office visit in full, or they'll pay a portion of it, but you still have your copay and your coinsurance. So a lot of people don't understand that, which I think it's by design, because if you think about it, a patient goes and purchases a product. The product is the insurance plan. The doctor's not part of that decision making. So you're purchasing a product, you don't understand how the product works at all. Then you bring that product to whatever doctor you choose, and the doctor's supposed to explain to you how your product works. And you get upset, not at the insurance company, but at the doctor when something is not covered or you have to spend more than needed. And I think that's by design, because I find that insurance companies want to pit patients against doctors while they stay in the background pulling all the strings. And a lot of patients don't even understand that that's happening. Now, since COVID, a lot of patients have been very educated about just the state of medicine and insurance and things like that, but a lot of people are still in the dark.
Yeah. So you said so many things. So the product is not understood. It is absolutely by design. That what I just published is, I talk about the opacity. The opacity is on purpose. The product also is not even being purchased by the patient. Typically, the product is being purchased by the employer, because our federal government's kind of made those policies. So the employer has a choice, and the insurance companies are working to please the employer. They're literally not working to please you. They're working to offer plans to please the employer. I mean, the system is just like unbelievable. So I've talked to many employers, and they laugh because they know their plans are terrible. Like they just know, like, the plans are terrible. Everybody knows this. I think maybe except the patient who's hoping for the best. And a lot of times the patient doesn't really know, because blessedly, they don't reach their deductible. They don't reach their maximum. But I want to wake people up to that $2,400 you're spending every month. And if you think you're not, you are spending that. Even if the out-of-pocket portion is half of that, the other half is coming out of wages that you're not getting. Those are wages that you earn that the employer is spending on your behalf. So if you have any flexibility, you're an employee, but if you have any flexibility and you can pull yourself out of that, you should. if you're self-insured, if you own a small business or self-pay or you own a small business, my God, you need to like immediately go to goldcare.com. The insurance, Drew, don't forget to tell people what the link is. But we've got a better system for you. I mean, I should like go back and forth with you, Dr. Pierre. Like, if you wanted to build like a great insurance product, like you don't know how we've set it up, but you should like throw things at me. Like, what would you want it to be? Because for me, it was all about freedom and price. But
absolutely. And I think, unfortunately, freedom and choice and options are things that Americans take for granted until they're in a situation where it really hits home. And what we're trying to do is, to the best of our ability, help you avoid those situations, be an informed consumer, know what it is that is going on with you, see the right doctor who has your best interests at heart, who can maybe even help you prevent some complications, help you with natural products rather than drugs, just different things like that, the way medicine really should be practiced. Because as you mentioned earlier, there are definitely a lot of outside pressures on doctors. I'll give you a perfect example. There was a push many years ago when the whole electronic medical records started. And so to get doctors to comply, and of course, the whole premise was all the systems all across the country are going to talk to each other. That's a lie. Still, 20 plus years later, systems do not talk to each other because it sounded good. If I live in Florida, I'm visiting New York and I have to go to the emergency room, they have my entire patient file. No, they don't. That's not a thing. But they were asking for a lot of demographic data that you had to submit. And if you didn't submit it, there would be a penalty in your reimbursement. So in the beginning, I looked at all of that stuff that they wanted, and I thought, this is rather invasive. Like, why do they need this information on patients? This information has nothing to do with why they're in the office. So I was probably in the minority, I chose to take the penalty because I'm not willing to continue to feed this beast for whatever reason they want it, probably some nefarious purposes, because we know how governments are and how insurance companies are. But a lot of people are not willing to take that stand. And for me, when a patient tells me, I trust you, I don't take those words lightly. They mean a lot. And I want to be able to live up to that and make the decision that's best for the patient.
I really want to invite everybody to learn more about GoldCare Insurance. It's one of the reasons we're doing this town hall tonight, is because I feel so strongly that the American public is being abused by the insurance system, absolutely abused. You're being overcharged. You are having less money in your pocket. You have almost zero freedom when it comes to your health choices once you've signed up to an insurance policy. The insurance policies are being picked by employers. They're not being picked for good, like great results for you. And then, I mean, there's just so many problems with it, and I can't urge you enough to be done with it. And there's something that I learned in the last couple of months that I just think is a good way to understand is like why things are so expensive is that when you have other people using the product that you're buying, it's always very inefficient. And I'm just going to talk some geek stuff now. The economist Milton Friedman, most people at least have heard his name, probably like the premier economist over the past century. He famously described 4 ways money can be spent. A person can spend their own money on themselves. They could spend their own money on someone else. They could spend someone else's money on themselves, or someone else's money on someone else. And depending on which of the 4, it determines how attentive people are to the price and the value of what you're getting. When you spend your money on yourself, you pay attention to the price and you pay attention to the value.
Oh, yeah.
When you spend your own money on another person, you tend to pay attention to the price, but not really the value. You're buying a gift for your friend, you kind of say to yourself, okay, I'm going to spend $50 or $100, but you're less thinking about the value than if it was just for yourself. When you spend another person's money on yourself, you tend to care a lot about the value, but you don't really care about, like, if your mom or dad is buying you something, you're like, whatever, but I'll get the best thing I can get.
Right.
And when someone spends someone else's money on someone else, you don't pay any attention to the price or the value. That's exactly what's happening in the insurance model. So you literally are funding a system that's massively financially inefficient and also making it really hard for you to see the guy you want to see. In fact, that's so common that tons of people simply just go out of network. So they pay all their fees every month, but then they just go out of network because something happens, but they go, okay, but I got to go see that guy because that guy's the best guy. And, he's the guy. I want to see that guy, and that guy's out of network. And you have to ask yourself, well, then why do I have this health insurance policy? Anyone who's been through this, please come check out GoldCare Insurance. And again, especially if you're a small business, you're going to want to change. You're going to want to save that money, for better entrepreneurial purposes. Drew, back to you.
Thanks, Dr. Gold. If you would like to learn more about GoldCare Insurance, it is goldcare.com/insurance. You can fill out our form there. We will keep you up to date with everything we have coming for individuals and families. And also, if you're a small business owner or have insurance needs for your business, we would love to help you out. That one will be coming very soon too. So again, that's goldcare.com/insurance. Thanks. Back to you, Dr. Gold.
Yeah. And that's just to find out more information. That we're not selling anything. That's just to find out more information so you can get yourself better health freedom. I mean, I'm sad that, Dr. Pierre, that people really have linked in their minds like health insurance with healthcare. Like it's unfortunate.
I agree, but it's by design. Everything they do is by design.
Yeah. So again, if you've got Medicare, you stick with that, but you make sure you're a GoldCare member, right? goldcare.com/Dr. Gold. And then the first month is on me, goldcare.com/Dr. Gold. And in this way, you are protecting your health because you're going to get the answers. You're going to get access to the independent doctors who are just there for you, the doctor-patient relationship. That's available to everybody, but especially, the Medicare age group. I want you to make sure you get the right care when you go visit your Medicare doctors. For everybody else who's under the Medicare age, who's, just paying out of pocket for their insurance or not having insurance or small business, you absolutely have to check out GoldCare Insurance for sure, because you're going to save money. And most importantly to me, you're going to have a lot more freedom to pick the guys that you want to pick. That's the main thing. Any other final closing thoughts that you might have on this topic, Dr. Pierre?
Well, choices equal freedom. And unfortunately, we take our freedom for granted until it's taken away. And I think COVID was a wake-up call for a lot of people once their freedom was taken away. And so what we want to do is just operate within that freedom space all the time as much as possible. And this GoldCare provides a way for that. Because now you have doctors who care about you, who want the best for you, who will give you the best plan. And like Dr. Gold said, even if you have to see your Medicare doctor, at least you know what the plan should be, and you have questions that you can ask. And GoldCare Insurance is an alternative to the current oppressive, broken system.
I realized I don't think I really told people. I mean, I just very briefly hinted at it, what GoldCare Insurance looks like. It's very, very simple. So essentially, you pay all your medical expenses until it hits $3,000, which for most people, most of the time don't hit $3,000, right? They'll have to go to the drugstore, they get a medicine or two, or maybe they get an X-ray, or maybe they get a lab. A lot of people have no medical expenses in a year, especially people who like GoldCare really focus on their natural health. But if you hit 3,000, right, something happens, you have a car accident or, unfortunately a serious diagnosis, then the GoldCare Insurance kicks in, right? And then you have total coverage. That's one of the things I love about it, is that you make those rational decisions. You look for the best prices, you look for cash prices on the small stuff. But if the big stuff happens, you've got actual coverage, actual protection. That's huge, that financial safety net. The other part is you can go see any provider that makes sense to you. You go see the guy that you like, that you trust, that you have faith in. That's unbelievably important. I hated the idea of somebody deciding for me what limiting, I should say, what my choices would be. I absolutely hate that because I don't trust why somebody's telling me that person over that person. Like, I don't know. Not only do I want to make the decision myself, but I'm a little skeptical about why they're recommending Dr. A over Dr. B. Like, I want it to be a neutral situation. So GoldCare insurance is really, really easy. It's a lower premium. I haven't seen any situations yet where we're not at least 25% lower than competitors. We've worked really hard to keep the price as low as possible. It's a very simple plan. If you hit $3,000, you have coverage, and you have total freedom as you go along. So hope you check it out, goldcare.com/insurance, and tell all your friends, and come on over to the light side, the side where you get to be in charge. I think that's it.
You have nothing to lose and everything to gain.
Yeah, exactly. And by the way, again, I'm going to say again, I've gone without health insurance probably for close to 20 years. And I'm a complete medical insider. I've been an ER doctor for 25 years. And I'm telling you, the system is broken. It wasn't able to be fixed. And that's one of the reasons we built GoldCare. And it is the reason we're launching GoldCare insurance, is to give you something that's not broken, that is patient focused. So we ask you to join us. And I guess we'll have Drew come sign us out, and we'll follow up after that.
Thanks, Dr. Gold. Dr. Pierre, again, Dr. Gold, great conversation. Very, very enlightening. And it is true. GoldCare is the solution for you. We cannot allow the government to dictate our healthcare and our medical decisions. We have to take the personal responsibility and control back. The way you do that is through GoldCare. We saw a lot of questions tonight about how to get started, what to do. The best part is you can get started for free, $0. Join us at goldcare.com/Dr. Gold. Sign up. Dr. Gold will cover your first month. You can have an appointment with one of our nurses to learn about GoldCare, to help you better understand the services we offer. We'll give you that complimentary. And we just have so much for you to do and see and learn at GoldCare. So again, that's goldcare.com/Dr. Gold. GoldCare insurance is coming soon, and we are looking forward to seeing you next month for our next town hall. God bless you and good night.
Do you feel like the healthcare system is failing you? That's because it is, working exactly as intended to prioritize profits, bureaucracy, and big pharma, while leaving you and your family vulnerable when you need care the most. We understand your frustration. You've been asked to trust a system that feels rushed, impersonal, and biased. You deserve better. That's why we created GoldCare. Here, your values matter, your choices matter, and most importantly, you matter. GoldCare is more than a solution. It's a revolution. Trusted by over 10,000 members nationwide, we've built a system that puts your wellness first. With ethical, independent doctors who work for you, not the system, you'll have access to care that's transparent, trustworthy, and aligned with your values. We understand that stepping away from the familiar can feel daunting, but staying in a system that doesn't truly serve you is even harder. That's why GoldCare offers a healthcare alternative designed to work for you. Whether you're ready to step away from the system entirely or prefer to keep your insurance while seeking the transparent care, ethical doctors, and education you deserve, it's time to stop trusting a system that's failed you. Take control of your health with GoldCare. Join today for $17 a month and become part of a healthcare revolution. GoldCare, built for you, powered by freedom, trusted by thousands.